This is the initial project of the AAC Research Alliance that was created with Thames Valley Children's Center and Holland Bloorview to start with, and we wanted to be able to expand it to other clinics with an opportunity to be able to share as we go and as we learn for this particular study. So we're just getting underway, and the purpose of the webinar is really to provide a brief 50,000-foot overview of the project and tell you where we are with things. So the objective of the webinar, it all relates to this project, is really threefold. One, we're going to tell you about the study, looking at functional outcomes associated with AAC interventions for young people. You're going to learn about not only the study, which is most of what we're going to be talking about today, but also learn how to stay tuned into the study and as things progress, and learn about things that we're learning as we move forward with trying to understand functional outcomes for children. And then we also wanted to let you know about a survey that we're planning on conducting, so that way we get to know a little bit more about each other, and we'll share the outcomes of that. So although I'm talking now, I'm also going to be joined by other members of the team too. They'll be talking about different elements of the webinar. So for the first objective, I'm going to be starting off and talking about the project, and Anne-Marie will tell you a little bit more about the protocol for the study. So this particular project is funded by the Canadian Institutes of Health Research, and there's a program at CIHR called Partnerships for Health System Improvement, or FIATS-AAC for short. And it's an opportunity for knowledge users and researchers to work in partnership to receive funding to allow us to explore areas of health that could be improving services. We also have not only members, knowledge users from Thames Valley and Holland Bloorview, we also have a decision maker from the Ontario Ministry of Health and Long-Term Care too, because there are policy implications to the work that we're doing. We'll get into that a little bit more as we move forward. So this was a project that was funded last summer, so we're about a year into it, but it's taken a bit of time for us to get through our research ethics, and then also just getting the team up to speed where we can start doing recruiting as you'll find out shortly. So here are the members of the project team, the investigative team. So I'm leading the study, but have support from knowledge users, frontline staff, knowledge brokers, collaborative practice leaders, and researchers from different centers at Holland Bloorview and Thames Valley. And Michael Hilmer is our decision-making knowledge user who's in the policy group at the Ministry of Health and Long-Term Care in Ontario. So here's a little bit more about the study rationale. I'm not going to go into great detail around that. I think people generally agree that AAC interventions can have a big impact on the communicative competence of children with CCN. I think we've got lots of evidence around that. People that were at the workshop at Holland Bloorview have heard that there's lots of empirical evidence to support this. But what we don't really know a lot about is understanding what the functional outcomes are associated with using it. We know that children's communication improves using AAC, but what does that translate into real everyday life in the lives of children and families? So we really want to understand that more, because we recognize that if there's positive outcomes associated with that, and if families recognize that there's benefits associated with AAC use, that in turn will have positive outcomes for children that are using systems and devices to augment their communication. But one thing that isn't clear is ways in which we can measure these functional outcomes. So that's really what the purpose of this study is about. And we lost a little bit of the framework on here, unfortunately, when we uploaded this to Adobe Connect. But I think people are familiar with the International Classification of Function for children and youth. The idea is that contextual factors, the interaction of contextual factors and health conditions is a way to conceptualize what the functional impact is on children with complex communication needs. So if we can develop a measure that taps into measuring elements of activity and participation, as well as body structure and function, this will give us an idea about a child's functioning. And we want to be able to do this from a perspective that would allow us to to understand more about how we might be able to tailor services to be able to improve outcomes for children. So what we've done is we spent a number of years developing a new measure some of you may have heard of called the Family Impact of Assistive Technology Scale. The foundation of it was developed around adaptive seating, but we've developed a separate module which taps more into AAC outcomes. So we wanted to be able to develop a parent report measure. We recognize it's important to be able to understand the perspectives of children, teachers, others that are involved, other communication partners, but we thought we would start with parents. And we also thought we would start with children that are entering the school system up until the age of 18. The way that to give you a bit of an orientation around the FIATS-AAC is to just help you to understand by describing how the FIATS-AAC is actually constructed. So there's 89 items which take the form of statements that a parent would read, and those items are assigned to one of 13 different dimensions, which I'm going to be describing. Each of the dimensions includes 5 to 9 of those items, and the absolute score. So if the score is higher, it means that it is higher functioning for that particular dimension or in total. So a positive change score, so if we're measuring before and after, if we see something positive changing, that means there's a positive outcome associated with that change. So here's an example on the bottom of the slide. So the statement would be, my child has a tough time starting a conversation. So a parent would read this and say the degree to which they agree or disagree with this statement. So if you can imagine that if we administer this measure before the child receives an AAC intervention, and then again after, if it's a positive outcome, we'd expect that the child wouldn't have as much of a tough time in starting a conversation if the AAC system that was provided was effective. So that just is a microcosm of how you might see change. So because we have 89 items, we're not expecting all of the items to change in the same way, but we're expecting most of them to change in a way that allows us to be able to measure whether there's a functional change. Okay, so again, we're losing a little bit of the graphics associated with this, but effectively there are 13 different dimensions that the FIATS-AAC covers, and this gives an example of the items that are associated with different scales that relate to child-related dimensions, and we also have dimensions that relate to family-related dimensions, because we recognize that it's not all about how an AAC intervention impacts a child, it's also how it impacts their family. So we want to be able to include dimensions that will cover both child and family-related outcomes, and that way get an overall idea of what the effect is of the AAC intervention. So I apologize for the loss in translation on this particular slide. So just to give you an idea of the status, so we've spent the past 3 to 4 years developing the FIATS-AAC, and this is a single slide of the work that we've done to be able to get it to the stage where we're using it in our existing study. So we've had nearly 180 parents of children, as well as clinical experts that have been helping us to establish the measurement properties of the FIATS-AAC. We've got really good evidence of content and face validity, so that's normally the process that we would go through to evaluate whether we're measuring the types of things that we would expect should be changing through the introduction of an AAC system. We've looked at the construct validity of the measure, so we've compared it to other standardized measures to get an idea about whether the FIATS is measuring elements of activity and participation. We've also demonstrated that it does have good internal reliability as well as stability. The piece that's missing, and the purpose of this study, is to now use the FIATS-AAC to be able to look to see whether it's able to detect change when we expect there to be change. So from a clinical perspective, if we're expecting that after we provide an AAC intervention, that you think that the child's communicative competence is improving, then we should also see a concomitant change in the FIATS-AAC. So that's really what the focus of our study is about. To get more information about the development of the FIATS, more information around the different constructs that are being measured within the FIATS. There is a publication which we're going to tell you about how to get access to this article too, so you can read more of the details rather than just me talking on one slide. But it'll give more detailed information around what those different constructs are, what the definitions are for those, and that way you can have that as a reference point for where we are with the current project. Okay, so people that were involved in the AAC OK workshop earlier this year may see that there's a particular format that we're following for a research question. It follows the PASICO model. So we want to be able to answer this question. So all of the work that we've done in the development of the protocol is all geared towards answering this single primary research question. So is the parent-reported FIATS-AAC responsive to functional change in children aged 6 to 14 years and their families 12 weeks following the receipt of a high-tech, graphic-based communication system? So as you hear more about the protocol, keep that question in mind, and you'll see how it's really reflecting what it is that we're looking at. We don't just do a research study to answer a single question, although everything is powered to be able to answer that question. We are looking at other outcomes as well. We do want to be able to look to see if we're able to detect even shorter term outcomes that are important. So we're going to also look not only 12 weeks after a child receives a new AAC system, we're also going to be looking 6 weeks after, just to see whether we can detect even smaller change than what we expect. We're also going to re-estimate the reliability of the scale and the subscales. And we're going to be looking at change in the FIATS-AAC and relating that to communicative performance. So we have some measures in place that allow us to look at that. Importantly, what we want to do with the FIATS-AAC is to get a better idea of when we see a change score, is that something that's really clinically meaningful? So we've got some other measures in place that allow us to be able to look to see if the FIATS-AAC changes 6 points, for instance, that those 6 points are actually meaningful. It's not just a statistical change, but also something that would be meaningful for us to look at. So the project's geared to do a lot of things, and that's why we want to be able to gather as much information as we can to help us to move forward with this. Okay, so I'm going to pass on to Anne-Marie Renzoni, who's going to lead you through the protocol, and then I'm going to be back with you in a minute just to talk about some other element of the analysis. Anne-Marie.
Thanks, Steve. So first part of the protocol, just go over who the participants are. So we are, there's 50 parents of children who have complex communication needs who will be taking part in the study. And these are parents of a child who is registered either at Thames Valley Children's Center or here at Holland Bloorview. So the parents are parents of children who are aged 6 to 14 who have been prescribed an AAC system and they're awaiting a high-tech graphic-based communication device. So in terms of the communication device, this includes any electronic communication device that stores more than one page of graphic vocabulary. The children can use any access method, so either direct pointing to the device, using a joystick, or using a scanning method. Eligible parents are the ones that provide primary care for their child, and they're able to understand English. So I'll just go over the protocol for the study. Parents will take part in 4 interviews over a 4-month period. So 2 of the sessions will be before they receive the communication device, which is T1 and T2, and then 2 sessions which will be after they receive the communication device, which is at 6 weeks and at 12 weeks, as Steve mentioned. And I think what didn't show up on the slide was after they receive the communication device, at 6 weeks they will have received 2 intensive training sessions. So this is training that the clinicians would provide to help the child and the team implement the device into everyday life. And so at 12 weeks they should have received 4 training sessions. So I'll just now go to this slide, which is a table outlining sort of what information and what measures are collected at each of the 4 time intervals. So the parent measures are administered by phone by a research assistant. So at time 1, the FIATS-AAC is administered to provide a baseline. And then at T2, T3, and T4, the FIATS-AAC is administered again along with descriptive and functional measures, which we'll talk about shortly. Also at the same time, clinicians are also recording their clinical observations. So at time 2, which is when the client gets the device, clinicians will actually record their clinical observations and ratings as well. So that's an overview of the timing. So just to give a little bit of information on the parent measures, and again, these are administered by phone. The FIATS-AAC, which Steve has already talked about. The next ones that are in brown are descriptive measures. So the child and family demographic interview, which was developed for the study, provides basic information on the child and the family and all the communication methods that the child uses in everyday life. The communication function classification system, it is a questionnaire that allows you to rate the child's everyday communication functioning along 5 levels. The manual ability classification system measures the ability to handle objects and the need for assistance. The next measure are functional measures, and the first one is the impact on family scale. So this is a 15-item scale which looks at parents' perception of psychological and social impact of having a child with a disability. The next item is the global rating form, which is a single-item rating scale measuring overall change in communication and functioning. So this is rated by the parents. And the next one is a participation measure, so looking at participation in the environment. And again, it's a parent report measure. And it really looks at the frequency of participation and also the degree of involvement of the child in a particular activity. So just to give you an overview of the clinician measures, the AAC clinicians at both sites have received on-site training and coaching to ensure consistency reporting on the data collection forms. So what the clinicians are reporting, first of all, is the current competency. So that's looking at the operational competency, social, strategic, and linguistic skills of the child at that point in time. So we're collecting that right when the child receives the device. And we're also recording specifically what training they've already had, what exactly the AAC system involved, what access method they're using, any kind of rate enhancement, and what the communication language system is. And communication continuing index is a rating of, are they at the emerging level, context-dependent, or independent level of communication. So again, after the child receives the device, 6 weeks after this data collection form is completed again, along with the clinicians are also filling out the global rating form, which again is that single item rating for change in communication functioning. And these are again repeated at 12 weeks, and that's 12 weeks after they've received the device.
Okay, so I'm not going to go into the detail other than to say that we're going to be looking at statistical change in the FIATS-AAC at 6 and 12 weeks. We're going to be looking at how big a change that is and making some judgment around how big the effect size is and relating that to how important it is, and then we'll also be doing some secondary analyses. We're going to be monitoring also knowledge use. So again, I apologize for the graphics not showing up on here, and we're going to be sharing the PowerPoint presentation with everyone so you can go back and see this. But we're actually going to be looking at the extent to which knowledge users are involved in elements of the study, in much the same way that you're participating in this workshop. This is all important information for us to be able to gather, and then also learning a little bit more about how that actually translates into service. So we'll be telling you more about monitoring knowledge use in future webinars. Project timeline, again, this graphic didn't show up. Boy, you can tell this is an inaugural webinar because we're having all kinds of problems with the technology piece. But we've really just gotten underway, and really over the next 2 years what we're going to be doing is doing recruitment and following 50 families that are receiving new graphic-based communication systems, and then doing analysis toward the end of, it'll be more toward the end of 2016, and we'll have a better idea about how the FIATS-AAC is operating at that point. Okay, so I'm going to pass on to Michelle Cervais at Thames Valley Children's Center, who's going to tell you a little bit more about how you can stay tuned into the project progress. Michelle, are you there?
Hi, Steve. It's me. Can you hear me?
Yes, I can.
Okay. Well, I'm really excited to tell everyone about our team website that we created to keep everyone up to date. Our knowledge users, our clinician researchers, and all of our team members about what's happening with the FIATS study. And this is an invitation-only website, so only our Alliance team members have access to the website. And this has allowed us to be able to share a lot of our study materials, our research articles, and other resources with you. So on the website, for example, we have contact information for all our team members, and we have some pictures of our team members, which we've found has been really helpful when you're working with a large team over long distances, just to be able to put a name to a face. And so we have various resources that people can get there, our study protocols there, research materials such as team minutes meetings, our study timeline, clinician scripts for introducing the study, research articles, and we also have a must-read list of the suggested articles from the top AAC researchers from the Outcomes for Kids workshop. We've also have posted questions and answers about the study there as well. So you might want to know, how do you get access to this our team website? All our Alliance team members are going to receive an email from Madhu, and it's going to contain the following information. What we've done is we've used Google websites, and so to be able to sign into our site, you in a couple days will receive an invitation from our website, and you will need to sign into your Google account to be able to access our website. And this is how we can control entry to the website. And Google accounts, if you don't have one, are free, and so we'll send you information about how to get a Google account. Basically, to use all the functions of the team website, you need to send, you have to use the email address that you specified for your Google account. So we're going to send the information that Madhu has about your email address, but if you have a different account that you've linked to your Google account, a different email address, then you can send that one to me, and I'll give you information about that so that I can make sure you can access the website using that email address. So once you get to our website, you can take a little look and let us know if there's anything you want added. And you'll find some of the pages, you'll have editing privileges, so you can add and share information. Or if you can prefer, you can send anything you want to share to Madhu. And that's everything about our website.
That's great. Thanks, Michelle. Okay, so now we're on to the third objective, and Shauna Kingsnorth, the Blurview Research Institute at Holland Blurview, is going to be telling you a little bit about a survey that's coming up around the AAC OK Research Alliance. Shauna.
Great. Hello, everyone. So as Steve mentioned at the beginning, with our Research Alliance, we have a real opportunity to create a national presence. And so what we'd like to do to support the members who are part of our alliance is to create a profile of all the AAC clinics across Canada in order to map out kind of where they're common, where they're different, and really just get a broad profile of the types of clinics that our members support. And the intent of this is to support future research and knowledge exchange opportunities. So our plan for the survey is going to take place over the next 2 months. From now till mid-June, we're going to be finalizing the content of the survey and then sending out an invitation to all of our members to take part in it. So that data collection would be happening mid to end June, and then data analysis and sharing of the profile would take place in July. And this is information, as Michelle said, that we would be showcasing on our website, creating profiles of all the different clinics that are involved. And so just to give you a bit of a flavor of the types of things that we think might be important to describe in this profile, we're interested in better understanding the range of client demographics that the clinics across Canada support, this clinic staff complement, types of AAC systems, service delivery models and evaluation activities, as well as research involvement in partners. And we think all of this information will be really helpful to kind of ground all of our members in terms of our commonalities and differences and explore opportunities for how we might engage in future research projects, how we might share information in the current one, and really just set the stage to really maximize our knowledge users. So stay tuned for that.
Great. So we're just a minute away from ending. I just wanted to thank everybody for joining this brief webinar, just to give you a flavor for what the research study is that we're doing at both Thames Valley and Holland-Bloorview. And hopefully that you'll stay tuned in by the website. And if you have any questions, just feel free to email me, or you could do it through Madhu. And we'll be happy to answer any questions that you might have around the study. And we'll also post those on the website too. So hopefully you get a chance to be able to access that and give us some feedback around whether the information that's included on it is helpful. Again, thanks for joining us, and hope everybody has a great day. Bye for now.